And so just this year, the American Academy of Pediatrics reversed their guidelines on weight loss surgeries in kids. They used to be against it, and now they say it should be considered in teens in extreme cases in order to eliminate comorbidities that can impact them for life. But nobody wants to get to that point because those surgeries also come with their own complications. So Dr. Kumar says patients need to have these conversations with their pediatricians to come up with plans to have a healthy diet. The Eating Recovery Center of Houston said that it might be best to have these discussions about obesity without the kids in the room, so as not to psychologically hurt them. But Dr. Kumar says kids should be there to be empowered by their own body, by their own health journey. So really complicated issue. I think maybe you'd have to figure out what might be best for your kid before you figure out how to talk to a pediatrician about it. You know, I mean, it's really sad that it's gotten to that point. But now, like Dr. Kumar points out, when you really dig into the issue, it's a very complicated, deep issue. So reversing it is also equally complicated.
The fact that a lot of the issues also are complicated by living in an underserved community.
Yep.
Right, because the snacks, the unhealthy foods, those are plentiful, he said. So that makes it, even worse.
So, I mean, he's in Southwest Houston, which is where we are, right? And I told him, I was like, does this classify as a food desert? Because, I mean, think about it. Where do you go for lunch? I mean, we here at our studio, sometimes you have to drive all the way down to Kirby, which for anybody who might not know, I mean, that's several miles down a freeway to get food. So I can understand that, yeah, his patients in this area, they don't have good access to food. And if your parents are at work, where are you going to go?
Right. Right. It's such a huge issue. And I think that also the extreme cases is trying to prevent, getting to that point.
Yeah.
So like they said, to talk to your children, a nice balance. How do you strike that balance is a big question, because you want them to be informed about their health, but you don't want to make them feel bad or feel negatively about their own bodies.
And one thing I found interesting when I was talking to him is I feel like maybe probably just a few years ago, this was a really taboo subject where parents didn't want to hear it, or they were dismissive, or they said, they're kids, they'll grow out of it. Mm-hmm. He says now parents are very ashamed of where it's gotten to be, and they are willing to have the conversation and to change habits. But he says the only patients he's seen be successful at their children losing weight is when the entire family makes changes.
Oh, and that's so difficult for everyone to get on board. Oh, right. Some good tips there to try to look into at least. All right, Haley.
Absolutely.
Thank you.
Thanks, Sophia.